Hello everyone, my name is Ivy, one of the registered dietitian on the bariatric team here at TWH. Welcome to the vitamin mineral supplement module. So for our SADI patients, you're likely already familiar with the regular vitamin mineral supplement schedule based on your previous experience with the sleep. As you recall, for the first 4 to 6 weeks after surgery, you want to take chewable form of supplements as they're easier to get down in the first month after surgery. You should be able to find chewable options for multivitamin, calcium, vitamin D, and vitamin B12. However, some vitamins don't have a chewable option, such as the vitamin A, E, and K. So you will need to crush the tablets for these or open the gel capsules and mix it in yogurt or applesauce to take it. Alternatively, you can purchase ADEK multivitamins from US bariatric brands, Bariatric Advantage, or Celebrate from their website. So let's start with talking about the multivitamins. Remember the dose for the multivitamins, 2 per day. Make sure you're taking a multivitamin with at least 18 milligrams of iron. If you just started on a new bottle and unfortunately does not have 18 milligram, then you can consider adding a separate iron supplement. You can send us a message if you need help finding a right iron supplement. You would have received a multivitamin handout with a list of multivitamin products we found to meet the guidelines, so you can use that to help you make appropriate purchase. Some examples are listed on the slide. Next, we'll talk about the calcium vitamin D supplements. The total dosing you need is 1,500 to 1,800 milligram of calcium citrate per day. Calcium citrate is the preferred form for optimal absorption post-surgery. The tricky thing with calcium is that your body can only absorb about 500 to 600 milligram at a time, so you need to spread out the doses of calcium throughout the day. You have also received a handout containing calcium citrate with vitamin D products that meet the guidelines, so use that to help you make appropriate purchase. Some examples are listed on the slide. Dosing is going to depend on which supplement you're taking because they all contain different amounts. The most popular one is the Weber's Natural Calcium Citrate, often found at Costco. Since these pills are only 300 milligram each, this means to get to the required 1,500 milligram, we should aim for 2 pills for the first dose, 2 pills for the second dose, and 1 pill for the last dose of the day. Each dose separated from one another by at least 2 hours and also 2 hours away from your multivitamin, as the iron in the multivitamin can interfere with calcium absorption. So it's important that we space them out. Also important to know that if you are a postmenopausal woman, your needs are higher and you should aim for 1,800 milligram a day. Next, we'll talk about vitamin B12. You need to take 1,000 microgram of B12 per day. Previously, we had you on chewable dissolvable B12 dosed at 1,000 microgram. This is still okay to take, or some people do an injection for B12 once per month. You want to be careful of B12 that are extended release or time release. This will be indicated by a clock icon on the supplement bottle. These are not absorbed well and we don't recommend them. Now for the vitamins A, D, E, K, we're aiming for 10,000 units a day of vitamin A, 2,000 units a day of vitamin D, 400 units a day of vitamin E, and 300 microgram of vitamin K. Alternatively, you can purchase the ADEK multivitamin from US Bariatric Advantage and Celebrate sites if you don't want to take them separately. Please refer to your SADI vitamin handout for that information. This is a sample schedule for your supplements if you're taking the vitamin A, D, E, K separately. At breakfast, take the 2 multivitamins, prenatal multivitamins, and 10,000 units of vitamin A, and 1,000 microgram vitamin B12, or do the B12 injection monthly. Now, snack time, take 500 to 600 milligram calcium citrate with 1,000 units of vitamin D. Now, lunchtime, take another 500 to 600 milligram calcium citrate with another 1,000 units of vitamin D. Also take 400 units of vitamin E. Then at dinner time, take another 500 to 600 milligram of calcium citrate and with vitamin K 300 microgram. Now, at bedtime, take iron as needed based on your blood work. Remember to check in with your family doctor or pharmacist about potential interactions of these supplements with any medications you may be taking and modify your supplement schedule accordingly. This is the end of this module. I'll see you in the next one.